Welcome back, NCLEX Warriors. Today, we're diving deep into 50 insanely tough OB and maternity questions that most test takers fail. These are not beginner questions. We're talking clinical scenarios, trend analysis, and NGN-level traps. Stay sharp, think like a pro, and let's see if you can conquer them all. Grab your notebook, your mind's about to be tested. Question 1. A G4-P3 at 34 weeks presents with sudden onset severe abdominal pain, rigid uterus, and vaginal bleeding. Fetal heart rate shows late decelerations and minimal variability. What is the nurse's priority action? A. Administer oxytocin. B. Prepare for emergency cesarean delivery. C. Perform a vaginal examination. D. Place the client in left lateral position. Answer: B. Prepare for emergency cesarean delivery. Question 2. A laboring client with preeclampsia is receiving magnesium sulfate. Which assessment finding requires immediate intervention? A. Respiratory rate 10 per minute. B. Urine output 35 milliliters per hour. C. Deep tendon reflexes +1. D. Serum magnesium level 6.5 milligrams per deciliter. Answer: A. Respiratory rate 10 per minute. Question 3. A client at 39 weeks has a placenta partially covering the cervical os. She reports painless, bright red bleeding. Which order should the nurse question? A. Type and cross-match. B. Continuous fetal monitoring. C. Vaginal examination. D. Large bore IV access. Answer: C. Vaginal examination. Question 4. A postpartum client develops uterine atony unresponsive to oxytocin. Which medication is contraindicated if the client has asthma? A. Methyl ergonovine. B. Carboprostronofine. C. Misoprostol. D. Tranexamic acid. Answer: B. Carboprostronofine. Question 5. A laboring client has variable decelerations with each contraction. Which intervention should the nurse implement first? A. Increase oxytocin. B. Administer oxygen. C. Reposition the client. D. Prepare for cesarean delivery. Answer: C. Reposition the client. Question 6. A newborn of a diabetic mother exhibits jitteriness, weak cry, and poor feeding. Which condition is most likely? A. Hypocalcemia. B. Hyperbilirubinemia. C. Hypoglycemia. D. Polycythemia. Answer: C. Hypoglycemia. Question 7. A client at 28 weeks with Rh-negative blood has a negative indirect Coombs test. What is the correct nursing action? A. Administer Rho-D immune globulin. B. Repeat test in 24 hours. C. No intervention required. D. Administer after delivery only. Answer: A. Administer Rho-D immune globulin. Question 8. A client in labor suddenly complains of chest pain and dyspnea. SpO2 drops to 82%. FHR shows bradycardia. What complication is most suspected? A. Pulmonary embolism. B. Amniotic fluid embolism. C. Aortic dissection. D. Magnesium toxicity. Answer: B. Amniotic fluid embolism. Question 9. A client 1 hour postpartum has a boggy uterus displaced to the right. What is the priority nursing action? A. Massage the fundus. B. Administer oxytocin. C. Assist the client to void. D. Notify the provider. Answer: A. Massage the fundus. Question 10. A fetus demonstrates absent variability and recurrent late decelerations. Which interpretation is most accurate? A. Fetal sleep cycle. B. Umbilical cord compression. C. Uteroplacental insufficiency. D. Maternal hypotension. Answer: C. Uteroplacental insufficiency. Question 11. A laboring client at 7 centimeters suddenly experiences severe tearing pain and loss of fetal station. What complication is suspected? A. Placental abruption. B. Uterine rupture. C. Precipitous labor. D. Shoulder dystocia. Answer: B. Uterine rupture. Question 12. Which finding in a newborn requires immediate intervention? A. Acrocyanosis. B. Respiratory rate 68 per minute with grunting. C. Blood glucose 55 milligrams per deciliter. D. Caput succinatium. Answer: B. Respiratory rate 68 per minute with grunting. Question 13. A client with HELP syndrome is at 32 weeks gestation. Which lab value is most concerning? A. AST 85 IU per liter. B. Platelets 45,000 per millimeter cubed. C. LDH 520 U per liter. D. ALT 70 IU per liter. Answer: B. Platelets 45,000 per millimeter cubed. Question 14. A postpartum client reports calf pain, warmth, and unilateral swelling. What is the nurse's priority action? A. Massage the calf. B. Encourage ambulation. C. Notify the provider. D. Apply warm compress. Answer: C. Notify the provider. Question 15. A client receiving oxytocin develops uterine tachysystole with late decelerations. Which action should the nurse take first? A. Increase IV fluids. B. Stop oxytocin infusion. C. Administer oxygen. D. Prepare terbutaline. Answer: B. Stop oxytocin infusion. Question 16. A newborn born to an Rh-negative mother has a positive direct Coombs test. What condition is most likely? A. Physiologic jaundice. B. Hemolytic disease of the newborn. C. Breast milk jaundice. D. Sepsis. Answer: B. Hemolytic disease of the newborn. Question 17. A client at 36 weeks has sudden painless vaginal bleeding and a soft, non-tender uterus. What is the most likely diagnosis? A. Placental abruption. B. Uterine rupture. C. Precipitous labor. D. Vasa previa. Answer: C. Placenta previa. Question 18. Which finding indicates magnesium sulfate toxicity? A. Flushing. B. Nausea. C. Loss of deep tendon reflexes. D. Headache. Answer: C. Loss of deep tendon reflexes. Question 19. A newborn exhibits nasal flaring, intercostal retractions, and expiratory grunting. What condition is suspected? A. Transient tachypnea. B. Meconium aspiration. C. Respiratory distress syndrome. D. Persistent pulmonary hypertension. Answer: A. Transient tachypnea. Question 20. A client with a history of classical cesarean presents in labor. What is the nurse's priority concern? A. Infection. B. Hemorrhage. C. Uterine rupture. D. Preterm labor. Answer: C. Uterine rupture. Question 21. Which medication should the nurse anticipate for a postpartum client with severe preeclampsia? A. Oxytocin. B. Magnesium sulfate. C. Methylergonovine. D. Carboprost. Answer: B. Magnesium sulfate. Question 22. A fetus shows recurrent early decelerations. What is the cause? A. Uteroplacental insufficiency, B. Umbilical cord compression, C. Fetal head compression, D. Maternal hypotension. Answer C. Fetal head compression. Question 23. A newborn has excessive oral secretions, coughing, and cyanosis with feeds. What condition is suspected? A. Cleft palate, B. Esophageal atresia, C. Tracheoesophageal fistula, D. Choanal atresia. Answer C. Tracheoesophageal fistula. Question 24. A client with postpartum hemorrhage continues to bleed despite firm fundus. What cause is most likely? A. Uterine atony, B. Retained placental fragments, C. Bladder distension, D. Uterine inversion. Answer B. Retained placental fragments. Question 25. A laboring client has a temperature of 38.8 degrees Celsius, uterine tenderness, and foul-smelling amniotic fluid. What complication is suspected? A. Endometritis, B. Chorioamnionitis, C. Septic shock, D. Placental abruption. Answer C. Chorioamnionitis. Question 26. Which finding is most concerning in a client with ectopic pregnancy? A. Unilateral pelvic pain, B. Amenorrhea, C. Shoulder pain, D. Spotting. Answer C. Shoulder pain. Question 27. A newborn delivered at 30 weeks is at greatest risk for which complication? A. Hyperbilirubinemia, B. Hypoglycemia, C. Intraventricular hemorrhage, D. Meconium aspiration. Answer C. Intraventricular hemorrhage. Question 28. A client has a sudden gush of blood after delivery and the uterus is inverted. What is the priority action? A. Administer oxytocin, B. Apply fundal pressure, C. Call for immediate assistance, D. Insert Foley catheter. Answer C. Call for immediate assistance. Question 29. Which finding in a client with gestational diabetes indicates poor glycemic control? A. Fasting glucose 88 milligrams per deciliter, B. Polyhydramnios, C. Fundal height appropriate, D. Reactive NST. Answer B. Polyhydramnios. Question 30. A newborn has a sunken fontanelle, poor skin turgor, and dry mucous membranes. What condition is suspected? A. Sepsis, B. Dehydration, C. Hypoglycemia, D. Hyperbilirubinemia. Answer B. Dehydration. Question 31. A client experiences severe postpartum bleeding with hypofibrinogemia. What condition is suspected? A. Uterine atony, B. Disseminated intravascular coagulation, C. Retained placenta, D. Endometritis. Answer B. Disseminated intravascular coagulation. Question 32. Which fetal heart rate pattern is most concerning? A. Moderate variability, B. Accelerations present, C. Sinusoidal pattern, D. Early decelerations. Answer C. Sinusoidal pattern. Question 33. A postpartum client reports sadness, insomnia, and inability to care for the infant at 3 weeks postpartum. What condition is suspected? A. Postpartum blues, B. Postpartum depression, C. Postpartum psychosis, D. adjustment disorder. Answer B. Postpartum depression. Question 34. A laboring client suddenly has fetal bradycardia after membrane rupture. What is the nurse's first action? A. Administer oxygen. B. Check for cord prolapse. C. Increase IV fluids. D. Stop oxytocin. Answer B. Check for cord prolapse. Question 35. Which finding confirms placental separation? A. Sharp abdominal pain. B. Lengthening of the umbilical cord. C. Decreased uterine tone. D. Vaginal bleeding only. Answer B. Lengthening of the umbilical cord.
Question 36. A newborn with gastroschisis should be positioned how? A. Prone. B. Supine with legs extended. C. Supine with hips flexed. D. Trendelenburg. Answer C. Supine with hips flexed. Question 37. Which medication is used to prevent neonatal hemorrhage? A. Erythromycin. B. Hepatitis B vaccine. C. Vitamin K. D. Surfactant. Answer C. Vitamin K. Question 38. A client at 41 weeks gestation has decreased amniotic fluid. What risk is increased? A. Cord compression. B. Placental abruption. C. Shoulder dystocia. D. Uterine rupture. Answer A. Cord compression. Question 39. A newborn has bluish discoloration over the sacrum. What is this finding? A. Caput succedaneum. B. Cephalohematoma. C. Mongolian spot. D. Petechiae. Answer C. Mongolian spot. Question 40. Which finding suggests uterine involution is progressing normally? A. Fundus boggy. B. Fundus 2 centimeters above umbilicus. C. Fundus firm and midline. D. Excessive lochia rubra. Answer C. Fundus firm and midline. Question 41. A neonate with prolonged decelerations lasting greater than 2 minutes indicates what condition? A. Benign response. B. Fetal hypoxia. C. Head compression. D. Sleep cycle. Answer B. Fetal hypoxia. Question 42. Which client is at greatest risk for uterine atony? A. Prima gravida. B. Prolonged labor with oxytocin. C. Precipitous labor. D. Gestational hypertension. Answer B. Prolonged labor with oxytocin. Question 43. A newborn with meconian aspiration is most likely to develop which complication? A. Hypoglycemia. B. Pneumothorax. C. Hyperbilirubinemia. D. IVH. Answer B. Pneumothorax.
Question 44. A client with placenta accreta is at highest risk for what complication? A. Infection. B. Preterm labor. C. Severe hemorrhage. D. Uterine rupture. Answer C. Severe hemorrhage. Question 45. A newborn has a positive Ortolani sign. What condition is suspected? A. Clubfoot. B. Developmental dysplasia of the hip. C. Spina bifida. D. Talipes equinovamus. Answer B. Developmental dysplasia of the hip. Question 46. Which assessment finding indicates postpartum endometritis? A. Lochia serosa. B. Uterine tenderness. C. Fundus firm. D. Mild leukocytosis. Answer B. Uterine tenderness. Question 47. A client in labor develops shoulder dystocia. What is the first maneuver? A. Suprapubic pressure. B. McRoberts maneuver. C. Episiotomy. D. Zavanelli maneuver. Answer B. McRoberts maneuver. Question 48. A newborn with persistent pulmonary hypertension will exhibit what finding? A. Left to right shunting. B. Severe hypoxemia. C. Hypercapnia only. D. Bradycardia. Answer B. Severe hypoxemia. Question 49. A client receiving magnesium sulfate has absent urine output for 4 hours. What is the priority action? A. Increase IV fluids. B. Stop magnesium sulfate. C. Administer calcium gluconate. D. Notify the provider. Answer D. Notify the provider. Question 50. A newborn exposed to maternal opioids in utero is at risk for which condition? A. Respiratory distress syndrome. B. Neonatal abstinence syndrome. C. Hypoxic ischemic encephalopathy. D. Persistent fetal circulation. Answer B. Neonatal abstinence syndrome.
Congrats! You made it through all 50 questions. Only the elite survived this level of NCLEX challenge. If you missed a few, don't worry. That's exactly the point. Go back, analyze, and strengthen your clinical reasoning. Hit that like button, subscribe for more pro-level NCLEX mastery, and drop a comment with which question made you sweat the most. Keep grinding, future RNs. You got this.